What you just saw was me and my human taking a walk when she had a seizure. I had no idea what to do. Fortunately, I am now a trained epilepsy dog, and I know all about epilepsy. My pal Rex and I are going to tell you all about epilepsy and seizures. Epilepsy is defined as a chronic medical disorder that usually results in unpredictable, unprovoked, and recurrent seizures. Epilepsy affects more than 3 million people in the United States and about 50 million people worldwide. A person is diagnosed with epilepsy if they have 2 or more unprovoked seizures that cannot be explained by another medical condition, for example, high fever or a head trauma. Epileptic seizures occur when there is an abnormal and excessive electrical discharge of neurons in the brain. There are 2 main types of seizures that we will discuss today: focal or partial and generalized. Focal seizures occur in distinct areas of the cerebral cortex. Generalized seizures arise from both cerebral hemispheres simultaneously. Generalized tonic-clonic seizures, commonly referred to as grand mal, are the most common type of seizure, occurring in nearly 20% of all people with epilepsy.
Hi, I'm Rex, and I'm going to tell you about the symptoms of epilepsy. First, you may hear a scream. Some people may cry out at the beginning of a seizure. Then, there can be loss of bowel and bladder control. This may happen during or following the seizure. There will also be an unresponsiveness after a convulsion. Unconsciousness may persist for several minutes after the convulsion has ended. They will also be confused. A period of disorientation often follows a grand mal seizure. This is referred as possical confusion. They will also be fatigued. Sleepiness is common after a seizure. They can also have severe headaches. To be more specific, muscular symptoms include stiff muscles, rhythmic muscle contractions, or muscle quivering. Sensory symptoms include aura or pins and needles. And cognitively, there can be mental confusion or confusion following the seizure. Also common is blue skin from poor circulation, drooling, fainting, leaking of urine, lip and tongue biting, or sleepiness.
Rex, do you smell that? I think my human is having a seizure. I gotta go get with them, but I'm gonna send in my buddy Max to talk about the neural mechanisms of seizures.
Hi everyone, my name's Max. In order to understand the physiology and neural mechanisms of the brain that are involved in seizures, it is important to review the process of electrical transmission within nerve cells. Simply put, a nerve cell consists of an axon, dendrite, and a specific chemical composition on the inside and outside of the cell. Sodium concentration is higher on the outside of the cell, while potassium concentration is higher on the inside of the cell. Pumps are used to maintain this equilibrium. When a nerve is called upon to transmit an electrical signal, these salts move from one side of the cell membrane to the other, often via a neurotransmitter. These neurotransmitters either have an excitatory or an inhibitory function. Overactivity of excitatory neurotransmitters or underactivity of inhibitory neurotransmitters may lead to seizure activity by allowing an uncoordinated flow of electrical activity in the brain. The motor cortex, responsible for initiation of body movement, and the temporal lobe, including the hippocampus for memory, is more likely than other areas of the brain to be affected by a seizure. The most common seizures in children and adults are partial complex seizures originating from the temporal lobe, also known as temporal lobe epilepsy. These seizures begin with a visceral sensation and are followed by a state of impaired consciousness, automatic motor activities, or convulsions. It is often treated by resection of the temporal lobe, including the hippocampus and amygdala, due to its resistance to drugs. The most common lesions are hippocampal sclerosis, which will be discussed later on, tumors, vascular malformations, and more. Hippocampal sclerosis consists of loss of neurons in the dentate nucleus and the pyramidal layer of the hippocampus. Lesions to this area cause shrinkage of the hippocampus that can be detected by MRI. In addition to seizures, hippocampal sclerosis is seen in a significant proportion of patients with Alzheimer's disease and other dementias. This lesion has been the subject of a chicken or egg argument for more than 100 years. Some authors propose that the hippocampal sclerosis is the cause of seizures, and others believe that it is the result of seizures. People that believe the former view argue that the hippocampus is damaged early in life by birth injury, and this damage makes a person prone to seizures. Unlike the neocortex, the hippocampus continues to develop after birth and is more vulnerable. On the other hand, to support the idea that the hippocampal sclerosis is secondary to seizures, is due to the fact that even a single seizure can cause neuronal damage, and this damage may occur without convulsions, is cumulative, and relates to the duration and severity of the electrical transmission abnormality. Structural lesions are frequently detected in focal seizures. The most common such lesions are cerebral changes resulting from perinatal brain damage, malformations, trauma, brain tumors, and infections. These lesions involve the cerebral cortex and are characterized by neuronal loss and gliosis. Gliosis is defined as a nonspecific change in glial cells in response to CNS damage. Even minute lesions of the cerebral cortex may destroy, out of proportion, small, inhibitory, GABAergic interneurons, thus reducing the inhibition that controls large pyramidal cells that are found as excitatory neurons in the cortex. In summary, overactivity of excitatory neurotransmitters or underactivity of inhibitory neurotransmitters may lead to seizure activity by allowing an uncoordinated flow of electrical activity in the brain.
I think I hear my human calling. Gotta go. I'll send in my friend Jack.
Hi, Jack.
Hi, I have good news. Treatments are available that can stop or control seizures for most people with epilepsy. Like my friend Oliver mentioned, there are many different types of generalized seizures, and each person with epilepsy will experience a different type, a different combination of types, as well as a different duration and frequency. For example, people will have only one seizure episode in their lifetime, while others may need daily anti-seizure medications to prevent reoccurrence. Therefore, each person's needs should be considered individually. The first treatment step is to find the right medication for each person. Valproic acid has been considered the anticonvulsant, also known as an EED, of choice for patients who have multiple seizure types, including generalized tonic-clonic seizures. There are many types of AEDs, so if the first valproic acid doesn't work, a second medicine may be added to the first one you are taking. Some people do better on a combination of medicines than on just one medicine. Felbamate is used as an agent of last resort and is very effective. Another treatment aside from pharmacology is called vagus nerve stimulation. Although primarily used for the adjunctive treatment of refractory partial seizures, VNS has also shown to help reduce seizures in many types of patients with primary generalized seizures. Vagus nerve stimulation is a type of neuromodulation. It is designed to change how brain cells work by giving electrical stimulation to certain areas involved in seizures. 30 to 40% of people with epilepsy don't fully respond to anti-seizure drugs. Vagus nerve stimulation may be an option to reduce the frequency of seizures in people who haven't achieved control with medications. In conventional vagus nerve stimulation, a device is surgically implanted under the skin on your chest, and a wire is threaded under your skin connecting the device to the left vagus nerve. The right vagus nerve is not used because it carries fibers that supply nerves to the heart. When activated, the device sends electrical signals along the vagus nerve to your brainstem, which then sends signals to certain areas in your brain. If a person is aware when a seizure happens, they can swipe a magnet over the generator in the left chest area to send out an extra burst of stimulation to the brain. For some people, this may help stop seizures completely, and for others, it helps lessen the severity of the seizure. People who've had vagus nerve stimulation to treat epilepsy may also experience improvements in mood and quality of life. Another thing to be aware about is a change in diet. The most important thing to know is to avoid alcohol and energy drinks. Alcohol has potential to interact with AEDs and lower seizure threshold. Next, I want to talk about activity restrictions. Common sense restrictions for patients with epilepsy should be followed, such as not operating dangerous equipment, not swimming alone, and not taking baths unsupervised. Cooking with open flame may be dangerous as well. This is where my service dog friends come in. We help our humans live a more independent life.
Oliver here. I just got done helping my human, and she's doing great. There have been a lot of recent studies focused on seizure alert dogs. Us dogs are trained to assist people who have epilepsy or other seizure disorders by alerting their owner or other people around that the person is at risk of having a seizure. A family with a 7-year-old son named Hunter who was diagnosed with epilepsy when he was just 3 years old, has a seizure alert dog named Angel. Angel will bark or lick as a warning against activities that will increase risk of seizures, such as taking a bath or climbing stairs. Angel gives Hunter and his mom advance warning that allows the prevention of a seizure from occurring. In this case, Angel will warn Hunter and his mom that a seizure is coming, and a small magnet is placed over the vagal nerve stimulator that has been implanted in his chest, which blocks the seizure from occurring. Although Angel works for his family, there is no guarantee that seizure alert dogs can detect every seizure. Even though there is no guarantee, the demand for dogs is strong. There are many different ideas on how or why dogs may be able to detect seizures, some of which include using their sense of smell, training to pick up signals, and just naturally being born with that skill. 4 Paws for Ability is an organization that trains dogs for all kinds of therapy. Within a year, and after training 100 dogs, 40 of them will be seizure alert dogs. Another organization and training facility, Canine Partners for Life, is located in southern Pennsylvania, where they train dogs to become therapy dogs. The dogs go through extensive training and are put to the test by a local man who has epilepsy. This allows Canine Partners for Life to observe the dog and know if they can become a seizure alert dog. There is no hard evidence that seizure alert dogs will 100% prevent seizures, but they do have some sense to detect a seizure and, in Hunter's case, stop it, which is positive for any epileptic person.
We are so happy that we have learned all about epilepsy, and we hope you are too. Bye!
Bye!